If you're experiencing belching, bloating, or discomfort in your stomach due to excess gas, then Simethicone capsules might be able to help. Simethicone works by breaking up gas bubbles in your gut, providing relief from these symptoms. It's important to check the ingredients on the label, as they may have changed since your last use. Additionally, similar products with different names may contain different ingredients, so be sure to choose the right one for your specific symptoms. As for the dosage, it's best to follow the instructions on the label or as directed by your doctor. And for optimal timing, it's recommended to take the capsule after meals or at bedtime for the best results. When taking Simethicone capsule, always follow the directions on the product package. If your doctor has prescribed this medication, take it as directed. If you have any questions, ask your doctor or pharmacist for guidance. Take this product by mouth, usually as needed after meals and at bedtime. The dosage is based on your age, medical condition, and response to treatment. It's important not to increase your dose or take this product more often than directed. Do not take more of this product than recommended for your age. If you are using the chewable tablets, chew each tablet well and swallow. If your condition lasts or gets worse, or if you think you may have a serious medical problem, it's important to seek medical help right away. If you experience any unusual effects while taking Simethicone capsules, it's important to contact your doctor or pharmacist right away. However, most people do not experience any serious side effects while using this product. While rare, a serious allergic reaction to this medication can occur. Seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned, be sure to contact your doctor or pharmacist. In the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Simethicone, it's important to consult with your doctor or pharmacist if you have any allergies or health concerns. If you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid sugar and/or aspartame, caution is advised when using chewable tablets. It's also important to inform your doctor or dentist about all the products you use before having surgery. If you are pregnant or breastfeeding, it's best to consult with your doctor before using this product. When taking Simethicone capsules, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, if you take thyroid medication, it's recommended to take it at least 4 hours before or after products that contain Simethicone to ensure proper absorption. If someone has taken too much Simethicone and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can reach out to your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Make sure to follow up with your doctor and attend any scheduled medical or lab appointments. If you are experiencing discomfort from gas, you may want to consider limiting foods that are known to cause gas and bloating, such as beans, cabbage, and high-fat foods. You can also try using digestive enzymes to help with digestion. It may be helpful to consult with a doctor or a dietitian to review your diet and get personalized recommendations. Belching can be caused by swallowing too much air. Eating or drinking quickly, chewing gum, and smoking can all lead to swallowing more air, which can contribute to the discomfort you may be experiencing. If you usually take Simethicone on a regular basis and happen to miss a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take your next dose at the regular time. Avoid taking a double dose to make up for the missed one. When it comes to storing Simethicone capsules, it's important to keep them at room temperature and away from light and moisture. Avoid storing them in the bathroom and always keep them out of reach of children and pets. When it comes to disposing of the medication, make sure to do so properly by following the instructions on the label or consulting with your pharmacist or local waste disposal company. It's important to never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. And always make sure to discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.